Hi again, my beautiful people out there. Did you know that acne is actually a source of concern and affects daily the confidence level of adolescents, adult males, and adult females? Do we ever wonder why? Let's dive into today's teachings and we figure it out. What is acne in the first place? Acne is a common skin condition that occurs when hair follicles under the skin becomes clogged and the dead skin cells there all affect the pores. When it becomes clogged with what? Oil. Oil. Let's underline the word oil. Now, let's figure out what feeds on the oil or what happens to the oil on the skin that brings about acne. It's caused by a bacteria. I'm sure everybody keeps saying, oh, acne is caused by a bacteria, acne is caused by a bacteria, acne is caused by fungi, acne is caused by fungi. Today, let's find out which bacteria is responsible. It's with the name bacterium. How? What is the nature of this bacterium? It's anaerobic in nature. It's an anaerobic bacteria. What's the meaning of the word anaerobic? Anaerobic simply means it exists without oxygen. Anywhere that it's not properly oxygenated and that excess oil production is present, you will find an anaerobic bacteria. Now, what does this anaerobic bacteria feed on? Remember, we said clogged pores and dead skin cells, clogged pores with oil and dead skin cells. Now, how does it function? It's an anaerobic bacteria which lives deep within the hair pores and feeds on natural skin oil. Another name for this skin oil is sebum. We're going to figure out where this sebum is produced. If you see this drawing here, you would see this small portion. Don't mind my drawing. I'm not an artist, but at least it will give you an idea what I'm talking about. This is my rough sketch of the skin. Don't write it during your exams for the teenagers. Don't draw this. But it gives us an idea. This is the sebaceous gland that is close to the hair follicles and is somewhere in the dermis. Layers of the skin, we will get there. Different layers of the skin, the epidermis, the dermis, and the hypodermis. And why most people treat this acne with topical creams, with topical serums, and they say it's not going. It's not going to go because it's not even in the epidermis, which is the uppermost layer, and the uppermost layer of the skin has still 5 layers. The stratum basilae, is the one closest that makes contact with blood. Let's put it that way. Layman's language. That's the stratum basilae. Then you come to the stratum spinosum. The stratum spinosum. Then you come to the stratum granulosum. The stratum lucidum. This stratum lucidum, it's a bit different from other layers because they are not found on your arm, they are not found on your legs, they are not found on your back, they are not found on your tummy. They are found on your palm and on your feet, because if you watch, the color of my palm is the same color of my feet, but not the color of my skin, and is usually a bit harder in texture. And then you come to the stratum corneum. This stratum corneum is what it dies every 40 to 42 days. Did I ever tell you guys? Actually going for a facial is not a luxury. It's actually a need. Animals, let's be specific to maybe reptiles, like the snake, like the lizard. When the skin they have is dead, they shed it. If some of us could have seen a shedded skin of a snake, maybe somewhere in a reserve, in the forest, in the farm, anywhere, they crawl around, and after a while the skin is tired, it sheds off. Sometimes you see a lizard, you see some parts, especially when they are old, you see some parts of the skin shedding, some parts of it is already gone. That is in the animal kingdom. Not to talk of we humans. When the skin dies, the way to let it go is actually a facial. A proper facial from an aesthetic, a well-trained aesthetician in a spa. That helps you solve the issue of dead skin. Now, let's go over to the triggers. What are the triggers for this bacteria overrunning the skin and coming out in what is called acne, our friendly acne? One is hormonal fluctuation. Two is immune triggers. And three, trapped pores. I said that an anaerobic bacteria is a bacteria that breathes without oxygen, thrives without oxygen. So imagine what is happening when your pores are blocked. That way you are not breathing. The skin at that time, by the way, the skin is the largest organ of the body. And at that time, that largest organ of the body isn't breathing. Then this bacterium then has a field day, and acne then turns out to become a bother. Again, hormonal fluctuation. People usually think, oh, when you talk of hormonal fluctuations, is restricted to females. That's not the case. You see young teenagers, guys, boys, you see them with a lot of acne. At that time, their hormones are not balanced. I digress a bit. To what controls that hormone is the thyroid gland, so somewhere in our neck. For guys, growing up, we used to call it the Adam's apple. They say, is the apple Adam ate and he didn't digest, so he hung on the throne. But in the real sense, that is the thyroid for a guy. And this thyroid controls your T3 and T4, which, when messed up, your hormones goes haywire. But we are not for that today. So when this hormone, like your androgen, your estrogen, your progesterone, they're all not balanced. They call it hormonal imbalance. That, when it happens like that, it triggers the sebaceous gland. Please, my drawing is just to emphasize my teaching for the day. A medical student, a kid in secondary school, do not use this drawing for your exams. It's just for the purpose of pinpointing where it is situated and for the sake of our teachings today. So the sebaceous gland is within the dermis. These are the layers of the skin: the epidermis, the dermis, and the hypodermis. Now, that's why people will treat acne and say, oh, it didn't go. When you go and get a topical cream, and they'll tell you, oh, it's salicylic acid based. And you say, I've been rubbing it, but it's not going. It's not going to go. Because one, most creams we use are too dense that they do not even penetrate the epidermis, not to talk of the dermis. And that is where you get the sebaceous gland. That is where you get your hair follicles. That's where it comes out from. So if it comes along the way and is blocked, your pores are somewhere on top of here, which is the topmost part of your skin. From here, the sebaceous gland comes out and your pores are clogged. No matter what you rub topically, it's not going to solve your problem. So we leave that is for hormonal fluctuation. Then the immune triggers. When the sebaceous gland is overworking, is producing excess sebum, is producing another word for sebum, oil, and then your dead skin cells are there. Your skin is clogged, and that generates a inflammation. And once the inflammation occurs, then your immune system triggers, oh, there is a problem. There is a problem. We need to go solve whatever the problem is there. That gives rise to the redness, to the shootouts, to the types of acne you would see here: the blackheads, the whiteheads, the open comedones, the inflammatory acne, the papules and pustules, the cystic and nodules, which are different types of acne. This is the most persistent and the most scarring of them all: the cystic acne and the nodules. Now, after we've dealt with the hormonal acne, trap pores, immune triggers as the triggers of acne, we now go over to the different types of acne. Now, we first go to the non-inflammatory acne. They are the comedones, whiteheads. They are known as closed comedones and are characterized or appear as fleshy bumps under the skin. They are there. They make the skin uneven. When you feel your skin, you feel bumps until you actually try to press, that you get out the whitish stuff, which is the congealed sebum that is there. That's the whiteheads. Then you come to the blackheads, the open comedones. It appears on the pores of the surface of the skin. It contains excess oil. Dead skin appears dark, not because it's dirty, it's because it's been oxidized. That is, the excess sebum has been oxidized by air. That's what makes it, they call it blackheads. You see them making the skin look rough, makes it uneven. In fact, the actual mastery of acne is that it makes the skin uneven and it brings about scarring. But the good thing, if I may use the word, for the non-inflammatory acne is that they do not scar. They don't leave scars because they don't run that deep. Now, the inflammatory acne. This type of acne occurs when the skin is red and inflamed due to inflammatory enzyme activities on the pore and the hair follicles on the face. Examples of them are called pustules and papules. These ones are usually red, inflamed, and has a white center, and usually would leave a spot, however shallow, when treated. Then you come to the cysts and the nodules. If you're having cysts and nodules, you need urgent attention, because the longer you leave them, the more scarring you generate. At some point, when it keeps going on, you will see some people, even though the acne has eventually been treated, but you see they have like little pits on the face. I know for sure ladies don't like that, but I'm sure even guys wouldn't like it. But ladies, no, don't like that. Appearance is usually everything for a lady, and this type of acne gives that problem. It creates that problem for every woman, young or old. So here it said it has the capacity to scar deeply, is usually painful, longer time to resolve, and can inhibit, not even can, it inhabit the bacteria. If not managed on time, it creates the deep scarring on the epidermis that goes a bit to the dermis, and that makes it harder to solve. That is types of acne. Now, how deep or which skin level generates, where is the origin in the skin where this acne originates? It originates in the dermis, which is the reason why I decided to scribble this. This is where it is. This is the epidermis. This is the dermis, and this is the hypodermis. Now, the hair follicles is within the dermis. The sebaceous gland is within the dermis. So there is no way a topical cream, a topical serum can solve acne. It can only appear to say, oh, the first day seems like it's going, and then all of a sudden, boom, it comes out like ×2 or ×3. Okay, now we go over to the layers of the skin. As I mentioned earlier, the epidermis, the dermis, and the hypodermis. The epidermis is layered in 5. The stratum basilae, the stratum spinosum, the stratum granulosum, the stratum lucidum, and the stratum corneum. As I said, the life of the skin from the dermis starts from the basilae and goes to the spinosum, goes to the granulosum. Then this lucidum is unique. Stratum lucidum is not on every part of the skin. It only appears on your palm and on your feet. Then you have the stratum corneum. The stratum corneum is this that we see. And at this point, it takes the skin from the dermis to the epidermis about 40 to 42 days to come up to the stratum corneum, and then it dies. And when it dies, it needs shedding. That's where facial comes in. That's where 87-degree medical aesthetics come in. You need it gone. Otherwise, it becomes a dead skin cell, blocking your pores, and together with the oil, it clogs your pores. And I wouldn't say our best friend, a nightmare actually, especially for teenagers who their confidence level means everything, which is just being built, is a nightmare for them. So after that 42 days, it needs shedding. That is the layman's teaching for the epidermis layers. Then you come to the dermis. You have the papillary and the reticular layers of the epidermis. Then the hypodermis, that is where you get the adipose tissues, blood, the nervous system, the receptors, and where the adipose tissues is responsible for the blood and the lymphatic vessels. What are their jobs? They regulate temperature. That is where the nerves you find them, which are for sensory receptors, pressures, and vibration. That is where everything that is responsible for your nerve signals, impulses, XYZ, they are found within the adipose tissue. That is the fatty tissues of the body. Then this areola is the loose and connective tissue. That is where you find the elastin and the collagen fibers that anchors the skin. That one is another topic for another day, because it anchors it to deep within the fascia. Fascia for women or guys, anybody who suddenly begins to experience a large tummy, there is a fascia there. On the skin, there is fascia on the face, everywhere. And when the fascia gets weak, is due to when you're losing elastin and collagen. I wouldn't want to go on and on, because today we're strictly on acne. Now, what are the key take-home points for this acne? Acne needs to be treated timely, and an expert needs to do it. And it involves what is called extraction and scraping or scrubbing, with different people with their different wordings. It needs that scrubbing or scraping, a proper facial, to ensure that the dead skin cells are removed and that the pores are free and can breathe. Acne treatment usually would last. You need about 6 to 8 sessions, spread every fortnight, every 2 weeks, bi-weekly, any way it's interpreted, but every 2 weeks, not monthly. Reason being that the pores need to be freed, because the sebum, the sebaceous gland producing sebum, this triggers, cause it to be overactive, overworking, overproducing. So at that point, you need to go for a facial every 2 weeks. And again, you need oral. Now let's go over to how to solve, what to use for your acne. We've talked about what acne is, how to solve it. Now, what products to use to solve it. Benzoyl peroxide, retinol or retinoids. There are different forms of retinol. Topical and oral antibiotics. Please, my darlings, male and female out there, don't let yourself be deceived by anybody. There is no way, really, especially when it's a cystic or nodule kind of acne, that you're going to solve it permanently without a topical and oral antibiotics. However, do not take my video and say it's, oh, I need an oral antibiotic. It's not all of them. There are specific ones, and that is why you need a seasoned aesthetician or a seasoned spa. Because antibiotics are not good to play around with. As we know, they kill the red blood cells, they mess up the gut and the good bacteria in your tummy. So if not guided, the number of days it should be taken and the type to be taken, please do not engage. Now we come to salicylic acid. These products, these serums, would only work when the pores have been freed, have been opened, and made uninhabitable for the anaerobic bacteria, the gut bacteria. That is when you can come about the products. This actually, when handled, used judiciously by a professional, gets rid of this acne. But if not, it will give you the makeshift feeling, the mirage kind of feeling. Oh, I'm going, and then boom, it's back. And you say, oh, but I went to a spa and they did this and did that and did this, and it was like it's gone, but it came back worse. That's the reason why that happens. So with this teaching today, I would greatly indulge that we figure out where and who handles your skin for greater comfort, for greater confidence, for greater joy out of life. You know, there is a saying, when you come out looking good, you're already 70% to your destination, be it male, be it female. And as I always say, life is good when enjoyed properly, when you're healthy. So we meet again next episode for a better, happier you. Until then, as usual, my wonderful word, clock it.